Hi everyone, I'm Josh Robertson, and we're here today at the Cardiovascular Physiology and Rehabilitation Laboratory here on UBC's Vancouver campus, and today we'll be talking about whole body cryotherapy. So what is whole body cryotherapy? Well, unfortunately, it's not a groundbreaking way of freezing your body to preserve it, but it does involve a lot of cold and it does involve your body. Whole body cryotherapy is a form of therapy and exposure of the cold air, from Greek cryo, meaning cold, and therapy, meaning cure. Although unlike the cold air from a winter's day, cryotherapy is much colder, anywhere between -100 to -195 Celsius. So why put your body through temperatures way below freezing? Whole body cryotherapy is used to treat a variety of medical conditions, but in our case, in the sports medicine world, professionals use it in ways to optimize recovery times for their athletes. The idea is, if they can get their athletes to recover faster, they'll have more time to refine their skills, be bigger, faster, stronger, and better than their opponents. And one of those techniques for recovery is whole body cryotherapy. The after effects of intense exercise are something that we're all familiar with: stiffness, soreness, burning, and general fatigue. To reduce those nasty post-exercise effects, athletes can use whole body cryotherapy to recover from those effects faster. In a brief exposure, whole body cryotherapy covers the body with cold air and reduces core temperature rapidly. The rapid reduction of core temperature is what sets whole body cryotherapy apart from traditional forms of cryotherapy. Here's how it works. Extremely cold air rushes to the surface of the athlete's skin, causing an immediate vasoconstriction. This mechanism protects the main organs from getting too cold and rushes blood back to the center of the body. But the vasoconstriction is key. Tissue damage during exercise consists of tears, which causes edema and in turn suffocates neighboring muscle tissue. The extreme cold lowers the metabolic rate of neighboring cells, saving them from death. The vasoconstriction caused by that cold has shown to reduce pooling and in turn reduces inflammation. And the cold has also been shown to reduce pain by reducing nerve conduction speed. Whole body cryotherapy has also been shown to reduce enzymatic markers of inflammation, such as interleukin-1 beta, plasma C reactive protein, interleukin-1Ra, and creatine kinase. So now we know how whole body cryotherapy works, but how do the athletes use it to recover? Two popular techniques are used today. The first involves multiple temperature chambers at various temperatures, typically -10, -60, and -100 degrees Celsius. Athletes are instructed to walk through these chambers at specific time intervals, with the entire treatment usually lasting no longer than 3 minutes. However, time spent between those chambers seems to be the secret for optimal recovery. Another technique involving less movement is the cryo cabin. The cryo cabin is a single exposure method, and it consists of a temperature-controlled standing chamber with temperatures between -140 degrees and -195 degrees Celsius, again lasting a maximum of 3 minutes. This technique is often seen in spas, and in comparison with the temperature chambers, the athlete's head is not exposed to the cold air. And with that, I conclude. I'm glad to be able to share just the tip of the cryotherapy iceberg with you all. A special thanks to Dr. Darren Warburton and to the wonderful work of his research team here at the CPR Lab. This has been Josh Robertson, and thanks for learning with us today.